everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tizanidine. Its brand name is Zanaflex. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. So Tizanidine is an alpha-adrenergic agonist. It acts by increasing presynaptic inhibition of motor neurons at the alpha-2 adrenergic receptors. It's thought that by reducing the release of excitatory amino acids, we can reduce spasticity. So in terms of indications for use, like I just mentioned there, it is indicated to be used in the treatment of spasticity. Before somebody was to use Tizanidine, there is a contraindication they must clear, as well as some precautions and warnings they should be made aware of. This medication will be contraindicated in patients who are using potent CYP1A2 inhibitors. Examples of this would be fluvoxamine, as well as ciprofloxacin. Now, in terms of precautions, patients should be made aware that abrupt discontinuation of Tizanidine may result in rebound hypertension, tachycardia, and hypertonia. This would be especially a concern in patients who are also using narcotics, as well as patients who are using high doses of Tizanidine. Patients should also be made aware that anaphylaxis has been reported with this medication. The medication should be discontinued if there's any signs of this. It is not recommended that Tizanidine be administered with other alpha-2 adrenergic agonists. Hallucinations and psychotic-like symptoms have occurred with the use of Tizanidine. If hallucinations do occur, the medication should be stopped. Dose reduction, as well as heavier monitoring, is recommended in patients who use this medication who have hepatic impairment. Hypotension and orthostatic hypotension, as well as syncope, have all been reported with this medication. Monitoring would be recommended, and dose titration may also be necessary. It should be noted that liver injury has occurred with the use of Tizanidine. Dose adjustments and monitoring are recommended in patients with renal impairment. And lastly, patients should be told that the sedation associated with Tizanidine may be so impactful that it interferes with their normal daily activities. Once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Tizanidine, they can expect to receive their dose through tablet form or capsule form. So when a patient is using Tizanidine to treat their spasticity, they would usually use 2 milligrams every 6 to 8 hours to a maximum of 3 doses in one day. The dose can then be increased by increments of 2 or 4 milligrams every 1 to 4 days. The maximum dose would be 36 milligrams in one day. It should be noted that this medication must be taken consistently, and it can be taken with or without food. When patients come off of Tizanidine, the dose should be decreased slowly over time. We don't want to stop the medication abruptly because the patient would be at an increased risk of experiencing side effects from this. The last thing to note about dosing is that there is a clinically significant difference between the tablets and the capsules. So if patients start on tablets, they should stick with them, and if they start on capsules, they should stick with those as well. Now, as with all medications, there are some adverse reactions or side effects that patients may experience while using Tizanidine, so I'll list off some of those here now. Hypotension is seen in 16 to 33% of patients. Xerostoma can happen anywhere from 49 to 88% of the time. Dizziness falls between 16 and 45%, and somnolence can be anywhere from 48 to 92% of patients. Now lastly, one serious but rare side effect would be hepatotoxicity. That's all we're going to talk about today with Tizanidine or Zanaflex. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.